Hello, hi everyone. Dr. YY Choong here. I'm a cornea and refractive surgeon, and I practice in kpjcentreforsight since 2004. So it's about 20 years in KPJ, and my main practice in Center for Sight is in the PJ branch. Okay. So today my topics is more on refractive surgery, or in common knowledge to most people, you call it LASIK or relaxed smile, and I also touch a bit on cataract surgery as well. Okay. So what is laser refractive surgery? You know, based on the names, is we are using this laser to correct refractive error. Now, refractive error means those patients or those people who need to use glasses in order to see better. If you need glasses to see better, that means your eye has a refractive error. Okay, so a laser refractive surgery is using laser to reduce this power that you need to use contact lenses or glasses to correct. So now, instead of using contact lenses or glasses, you go for a surgery by using the laser to reduce this power. Okay, so the correction actually happens on the cornea. Okay, so the cornea is the most front part of the eyeball, which is shown here. This is the cornea. All right, this is the cornea. So when it comes to correction, we are using laser to change the curvature of the cornea. Okay, so for short-sightedness, in scientific term, we call it myopia. The laser will flatten the cornea, make the steepness of the cornea less steep, so that it reduce the power of the cornea and thus reduce the power of the eyeball. Okay, let's say for instance, short-sighted people need to wear glasses. So instead of using glasses to change the power, the laser will change the power from on the cornea, so that patients after the laser, they do not have to wear glasses. Now, when it comes to astigmatism, it is like you can imagine, let's say, football is round. Okay, so our cornea is supposed to shape like a football. But what happened now is, if you have astigmatism, the shape of the cornea is not like a football, it's more like a rugby ball. Okay, so because the shape is not normal, you need glasses or contact lenses to correct that. So with laser correction, the laser will change the shape of the cornea from a rugby ball shape into a football shape. Okay, so that's in a simple way how it works. Okay, so whether it is the procedure called femto LASIK or microkeratom LASIK or relaxed smile, these are all different way of preparing the cornea in doing the laser refractive surgery. They are all laser refractive surgery. Okay, only different way of making preparation on the cornea before the laser correction. Okay, so objective is all the same. Try to achieve close to zero power at the end of the surgery. So to help the patient to get rid of their glasses or contact lenses. Okay. The most important part when it comes to laser refractive surgery is actually the assessment and checking before the surgery, because we want to make sure the eyes are healthy and suitable for the surgery. So we'll do a lot of thorough many tests to find out whether the eyes are healthy and suitable or not. You know, sometimes the eye may be healthy, completely healthy eye, but the cornea may not be suitable for the procedure. For instance, the cornea is too thin, okay, or the power of the eye is the refractive error is too high, then the candidates may not be suitable for the laser vision correction. Then other mean or other way may be explained to the patient. There may be other way of helping the patient, but not laser refractive surgery. So that is the most crucial and important parts before the surgery. talking about this, why more and more young people wanted to go for laser refractive surgery and not using glasses or contact lenses to improve their vision. In Malaysia, we are very blessed because we don't encounter natural disasters so much. Okay, now imagine if you live in a country whereby frequently there's earthquake, there's typhoon, okay, or flash flood happen rampantly and frequently. These are places, the people there understand very well when disaster strikes. If they do not need to depend on glasses, when disaster strike, they will leave the place. For instance, earthquake, okay, straight away they'll leave the place when earthquake happen. It regard whether, because they do not have the dependent glasses. If they, let's say somebody really wearing glasses, first thing they do will have to look for their glasses first before they leave the disaster place. Okay, when earthquake strike, let's say. So when this thing happens, sometimes they have problem in getting their glasses, and then time's wasted, and this makes life and death a big difference when it comes to this split second of waiting. So in another place, in another say war zone, okay, in places that having war fightings, again same thing. Those depending on glasses will find that with the glasses they are very unsafe. A lot of time, they may lose their glasses during evacuation, looking for safe place. So these are the places, where they really appreciate a lot if they do not have to depend on glasses in their lives, in their life. Of course, here in Malaysia, we do not have this kind of problem. So for us, it's more of active lifestyle, okay? People who really, enjoy outdoor activities, sports, they will prefer not to depend on optical aids such as glasses or contact lenses. Okay, so it's more of lifestyle. Of course, anybody who is age 40 and above, they're starting to encounter a new problem. The new problem is they will have problem in seeing near. Okay, so this is called presbyopia. This will happen to everyone, okay, who is 40 and above. Now, for those who are short-sightedness, of course, they find that they can take down their glasses and see near. But if they want to continue to wear their glasses, that means they need to wear a multifocal glasses. Not everyone, can adjust to this multifocus glasses, and some find that they don't mind to wear a short-sighted glasses. They feel comfortable, but when it comes to wearing multifocal glasses, they got difficulties in trying to adapt to it. So there are also many patients who, when before the age of 40, they have no problem wearing glasses. After the age of 40, they find that they got problem. They can't see far well, they can't see near well. So they may seek for laser treatment to correct this problem as well. When it comes to laser vision correction, there are a number of different type of approach to laser vision correction. So what you have now in the market is number one, I think you can find in most of the laser center is called femto LASIK. Okay, femto LASIK. This is by using a laser, which is called a femto laser, to make a cut on the cornea. Okay, so that's how cross section of the cornea. So it cut the cornea. Okay, cut the cornea and then lift up the cornea like that into like this. Okay, then laser onto the cornea to shape it, and then the flap is repositioned to cover the entire wound. So this is one method. The second method is called relaxed smile. In relaxed smile, there is no such a big cutting on the cornea. Looking directly into the from the top down. Okay, this is the cornea front. Okay, in here front the cornea, and then pupil is behind. Okay, so this is by using again femto laser to make a very tiny small cut on the cornea, and then inside the eye, inside the cornea, it make a cut inside the pocket, make a pocket inside, and then through this small tiny wound, we pick up the cut inside the cornea. Is called lenticule. Removing the lenticule, okay, and change the shape of the cornea. So this is how a relaxed smile works. Okay. Number 3 is called ASA. Okay, ASA, one surface abrasion. Again, if you look, or you can see the cross section of the cornea. Cross section. Okay, this is the pupil. The laser applied directly onto the cornea surface, and then it actually remove the tissue layer by layer using the laser. So what happened is, at the end, let's say it's a short-sighted eye, it will become like this. Okay, so this part of the cornea is removed by the laser. So this is mainly the 3 types of laser vision corrections procedure. Definitely after the laser surgery, one of the most common problem related to this laser refractive surgery is dry eye after the surgery. Usually I will explain and inform my patient that the first 3 to 6 months, they will definitely feel the eyes drier compared to before surgery. For those who have dry eye before the surgery, definitely the eye will become even more dry in the first 3 to 6 months. But most of the time, you know, as long as they understand that they need to use some artificial tears or lubricating eye drop to make the eye comfortable, and most of the cases and most of the time, after 6 months or so, they'll back to normal again. Okay, but back to normal means for those who have no dry eye, after 6 months, likely they have no dry eye. But for those who already have dry eye to begin with, or to before the surgery, they will still continue to have dry eye. Okay, because the laser correction is to improve the vision. Okay, is to make the patient able to see well without optical aids. It's not to help in any other way. So that means if the patient has dry eye before the surgery, after the surgery they will still have dry eye. Okay, even 6 months after the procedure, everything will go back to the early stage before the patient went for the surgery. Okay, doesn't mean after the surgery, 6 months later, they will have a new pair of eyes, even without dry eye. If they have dry eye before the surgery, even after the laser, they have no dry eye after the surgery. It won't happen that way. Okay. Next, I'm going to touch on, briefly on cataract. I'm sure many of you heard about this medical problem called cataract. In fact, it's not a disease. It's an aging process that the lens in our eye slowly become cloudy. There's a piece of lens inside our eye which is clear and transparent when you're young. When you get older, usually after the age of 50 or even 60 years old, the lens slowly become cloudy. So when the lens become turn cloudy, it's called cataract. So again, it depends on the severity. See, it's an aging problem. It's just like white hair. Some patients had white hair at the earlier stage. Some had a white hair at a later age. Okay, so again, we can only say, you know, when someone has cataract, slowly the vision will be affected. That means they will find the vision gradually become more and more blurry, or they have this frightening to see lights. Okay, they'll find that when they're exposed to bright lights, the eye, they which they find that it's very glaring under bright environment. Or nighttime when they drive, they find the oncoming car lights will blind them if they have cataract. Okay, so the severity, you know, start from mild, of very mild symptoms of this problem that I mentioned earlier. Then when the cataract become denser, the severity will increase, okay, in a gradual manner. Okay, so the solution for cataract is to go for cataract surgery. The good news, the bad news is, of course, they need to go for surgery. But the good news is it's a very successful surgery, very predictable and very low risk surgery. Okay, so 90% of the time, patient will be happy to have the surgery done because number one, they see better. Number two, for those who initially wear glasses, they may be able to choose a lens that can help them so that they can reduce dependency on glasses after surgery. Or even those who wear thick glasses before the surgery, after the cataract surgery, they do not have to wear thick glasses anymore. It will be a thin pair of glasses, and usually just for reading if they need glasses. Okay, as I said, the cataract surgery involves removing the natural lens that is already cloudy inside the eye and replaced with an artificial lens or artificial implant. Okay, so currently in the market, there are many types of lenses come with different functionality. So some can allow patient to see far or near well, and they need glasses for, you know, if they can see far well, then they need glasses for reading. This is called mono lens. Okay, so the mono lens allow patient to see either far well and then they need reading glasses, or they see near well and then they need glasses for far. Okay, then there are these lens that give the vision a good distant vision and also intermediate, far and intermediate. So this will be very good for those patients who, you know, do housework, cooking, only using handphone. Then they can see far, and these are more of intermediate activities. So by using these type of lenses, most of the time they don't need glasses and have very good vision. And only occasionally when they need to see something that is very near and very small print, they may have to use these reading glasses. But there will be also patients who, you know, after the surgery, they really wanted to see everything clearly without glasses. Then, of course, they can either choose these lenses that can give them far, intermediate, and near, or far and near. Okay, so no lens is what you call that perfect. Okay, each has its own advantages and disadvantages. So when it comes to choosing the lens, usually the consultant will check the eye first, see the data when it comes to measuring the lens power. Then most of the time, the consultant will give the patients one or two choices based on their activities. Okay, so that they can have a understanding why they want to choose A or B, or why A and not B, something like that. Okay, so the consultant that's going to operate on the patient will definitely give you a detailed explanation why this lens or that lens may be a more suitable lens for the patients. For cataract surgery, as I said, you know, there are a number of different type of lenses that can be used. So we call IOL, intraocular lens, IOL, intraocular lens. Okay, so the simple one is mono lens, or monotoric. So these are lens only give patient one good distance, one good vision, either distant or near. Okay. Then we have the far and intermediate lens called EDOF, extended depth of focus. So this one allow patient to see usually far and intermediate. Okay, then the third type is called a multifocal. And the multifocal allow patient to see all ranges lah, far, near, and intermediate. So there are many types. They have trifocal. Then we have also a bifocal. Mainly these two lah, bifocal or trifocal. We can use a combination of these lenses to achieve the desired outcome for the patients. The lens is actually implanted into the eye already. Okay, usually after about a month or so, the wound already healed. Patient can carry on with all their normal activities without any restrictions. For those of you who feel that you wanted to know more about LASIK, with a good reason why you do not want to depend on glasses or contact lenses, definitely you should have your eye properly checked first in those centers that can perform all the pre-surgery assessments, such as in KPJ, Center for Sight, and also for those who, of course, have any eye problem, for instance, not able to see well. Now, when we say not able to see well, if you are able to see well with glasses, usually it's because of power issue. If with glasses also you cannot see well, or in optical shop they couldn't check a good power for you, that means your eye may have real problem. Okay, so when it comes to real problem, you really need to go and seek your treatment soon from any eye center. And KPJ has a number of centers all over the Klang Valley, so you can look up from the website to find out the locations.